Our topic today is surveys. In research, we often use this methodology to collect data, but are surveys capable of capturing health inequalities and help us address health equity issues? Hi, I'm Katalin, your host for the day, and I welcome Dr. Rebecca Geary in today's podcast. Rebecca is an epidemiologist, a public health researcher at the University of Liverpool. So hi, Rebecca, would you mind telling us a little bit about yourself?
Hi, Katalin. Yes, I'm very happy to join you today. As you said, I'm an epidemiologist. I work in public health research, and my research focuses on understanding policy and system changes and their related impacts on health and well-being and inequalities in these. My background is in using both survey data and routinely collected health and social data. And we use this to examine inequalities in health and in access to healthcare, and also the impact of public health interventions on inequality.
You've got some really good experience behind you. Surveys are a commonly used tool to collect data in health and care research. So can you describe to us what actually surveys mean? What does that mean? What does that look like?
Surveys are a method of data collection where we design the questions that we want to ask. It allows us basically to ask the specific questions that we are interested in to generate data specifically for research and to answer our specific questions. So that contrasts with some other data sources that we often use in research that might be routinely collected, say when you go to the doctor at the hospital or your general practice. Surveys are different from that because you are in charge as a researcher of designing the questions that you want to ask. And you can ask as much detail about those things as you want, whereas data that are routinely collected or generated in health services or by your mobile phone, and that has implications how much we're able to use some of those other data sources. So if they gather more information about circumstances that can help us if we are interested in health inequalities. But there are lots of different types of surveys, I should say, that might differ in the way they find people to take part, how the questions are actually asked to people, whether somebody maybe reads them out, or the people who are taking part read questions themselves, or even if it's just completed on the internet entirely without an interviewer there. And surveys can differ as well in the types of questions that are included. So all of those things can influence the equity of surveys for data collection.
But what kind of or what type of data do we collect with surveys? Is it numbers, text?
To a certain extent, you're free to design your survey as you see fit to answer your questions. Typically, we would be, for the most part, collecting more quantitative data. So you might ask a question and have some written responses. So a question could be about somebody's age group, that would be a number, or you might be asking somebody about their ethnic background, or, whether they visit green spaces in their local area. And though it would be a written response that people could choose from, but when you analyse that, you might convert it to a number, but people would typically be having a closed number of responses to choose from. That said, you can have sort of free text boxes within a survey. So there's nothing to stop you having the option for people to answer an open-ended question and write a free text box. But you wouldn't typically include lots of those in a survey. If you were doing lots and lots of those, you might be better off doing a different method of data collection to answer your research questions.
Surveys are not the only data collection tool, but when are they actually preferred as a way of collecting data?
Yeah, that's a really good question, thank you. I think it depends on what your question is as to what's the best way to collect the data. So I think if I use health as an example, but that's my background, but that's not to say that it's only useful in health. Health surveys, they can collect data on everyone who might have a health need and not just those people that use health services. Whereas if we collect data from the health services systems themselves, you're only capturing the people who've already gone to the service. So the prevalence in the general population, or also behaviours as well. Behaviours are the types of things that are very rarely captured in other data. And we all know that is a key influence on sort of transmission of potential infections, and also really important for us to understand so that we can design public health interventions. The other thing that surveys are really good for in the health sphere is collecting information on well-being. That's something that's not normally captured in sort of electronic health records, but it can be a really important outcome for some of our research that we're interested in. So, for example, a research project that I'm doing at the moment looks at the impact of urban green and blue spaces on people's mental health and well-being, and we couldn't look at the impact on well-being if we didn't have surveys. And the other thing that surveys are really good for, well, if they're well designed, is they can capture greater deal on important contextual factors and demographic and behavioural risk factors. And those things are really important if we want to do research that's interested in health inequalities, particularly if we want to be able to take that step further. Having that additional detail, the granularity there is really important.
So that sounds like there's quite a lot of benefits to surveys. As you mentioned, we can ask questions in a survey that can help us measure the extent of health inequalities exist in a particular area or in different social groupings. However, some argue that surveys are an inequitable research method and one that can potentially lead to even more health inequalities. So can you explain what that means and how that might happen?
Yeah, absolutely. I mean, I think here it's important to say that, like most other methods, surveys aren't in themselves inherently an inequitable data collection method, but how well we can use them to support inequalities research depends on a couple of things. So the first is how people are invited to take part and the impact that has on how representative the group of people taking part in a survey actually is of the population that you want to survey. Another place in which we can encounter issues is when some groups might be less likely to agree to take part, even if they've been invited, or to answer specific questions that might be included in your survey. And the third area that they can come across problems is to what extent they gather the information needed for inequalities research. Now, we talked a bit about that in a well-designed survey, you actually are able to collect more of that information on kind of people's age or their gender identity or their ethnic background, their social class. But you have to have thought to include those questions in your survey in the first place, right? But the first two things, how you find your sample, how you identify those people, surveys by their nature, they take a sample from a larger population. So we know that we can't survey everybody. So we take a group, and how we find those groups influences how well they represent our population that we're interested in. If I use an example, if we used the electoral roll to identify potential participants for our survey, we know in advance that our survey didn't represent homeless people, for example. So I think what's really important is to think through all of those things. Who's your target population that you're interested in? And then how can you get your sample to be as representative as possible within practical constraints of that group that you're actually interested in? Because, well, you are interested in your sample, but you're interested in what inference or understanding that sample in your survey can give you about the larger population. So I think it's really important to be very clear when you talk about the surveys that you are doing, who is included and who isn't included, so that people can make a judgment about how representative it is and what conclusions you can draw from it. Another example is the third National Survey of Sexual Attitudes and Lifestyles. It's a very big survey in Britain. It identifies people through their residential addresses. And so all research published from that survey notes that those living in care homes aren't included. They couldn't have been sampled, if that makes sense. And there are also different ways that surveys can, even when you've thought of your population, there are different ways that you can actually find those people to participate and invite them to participate. And they have implications for inequalities research as well. So kind of more rigorous designs are around probability surveys. And that sounds complicated, but what it means is that we know the whole population that we're going to pick our sample from, and we have some random ways of finding who's going to be included. And that randomness means that we know what everybody basically in that population has a chance of being included in the survey, and we know what that chance is. That's really an important way of trying to reduce bias and kind of make our surveys more representative. But it's quite expensive to do that type of research, as you can imagine. You have to have a knowledge of all the people in the population. You are randomly selecting people, so you might be traveling all over. If your population is a whole country, right, you could be traveling all over doing your survey because it's randomly selected. So yeah, pros and cons from a practical perspective. There are other ways that surveys can sort of identify people to take part, and they're called non-probability surveys, and they don't have that element of randomness. So that might be more convenient sampling. For example, like if you are going to a sexual health clinic and seeing just people in that clinic, that one clinic. So you can see that it's much easier, probably quicker, less expensive to do that type of a survey. And depending on your question, that might be really the right population for you to be looking at. But if you wanted to understand more about the general population, using a clinic is not the greatest way to represent the general population. Those are some of the different ways in which surveys can be more or less equitable, I think.
So you mentioned these challenges or limitations, but how about thinking about in terms of the different types of surveys that we have? Because you also mentioned, I think, that there are many different types of surveys. So how does these health inequality problems come up in those other types?
So surveys can vary in how they select people, which is what we've just talked about. They can also vary in how people interact with them, whether that's people going to your house and knocking on your door and inviting you to participate in a survey, and they might have a paper questionnaire, or they might have an iPad or something for you to interact with. Or you could just be receiving an invitation in your emails for an online survey. You might see that online survey on social media or something like that. So there are those different forms of surveys in the way that they approach people and the way that people can complete them. With online surveys, I think there are kind of a very specific type of way of interacting with people, because there's typically not any interaction with a person. And in many of the online surveys that you might do, anyone can design an online survey using the tools that are out there. We normally don't know who received the invitation to participate. So we can't look at inequalities in participation because we don't know who got it. We only know who responded. There can also be a digital divide if some groups of the population, the whole population that we're interested in, don't have as much online access. Now, there are ways that you can try and overcome some of this. I work with a PhD student in the ARC Northwest Coast who was concerned about digital divide in their PhD research, and they purchased a tablet which they then took to community groups. So some people joined their survey through online advertising of the survey, but they also went in person to community groups in more deprived areas with the tablet to try and sort of overcome some of that digital divide. So I guess those are some of the things you need to think about when you are sort of designing those kind of online surveys. There are also survey companies. I guess lots of people come across like Ipsos Mori and survey companies like that. They're a bit different, again, because they typically hold demographic information on the people who are parts of their panel. So they can give a bit more of a representative sample because they already know a little bit about the people that they're asking to participate. And they can also know how many people are responding because they know who they've sent it to, and they've only sent it to specific addresses. But typically you won't get that sort of response rate information from those sorts of companies.
I was wondering, because you've mentioned so many challenges now and so many benefits, would it be possible to kind of recap a little bit how we can make our surveys more equitable?
Yeah, I think what would be a nice takeaway is that surveys themselves are not inherently problematic, but we need to have a few things in mind when we design them. So you need to be really clear who your population is that you're interested in, and whether the way that you're going to find them and invite them to participate in your survey has got those equity considerations in mind. So are all the groups that you're interested in likely to be reached by those methods? Is your information that you've written about why you're doing the survey and what's involved, is it accessible to all of those groups of people? And a really good way to do that is to actually get involvement early on when you're designing your surveys, right? And when you're designing your information sheets or your information text that you might have with an online survey, is getting input from people in the populations that you want to survey about whether this is accessible, whether they understand what it is that you're asking, why you're doing it, do they trust what you're going to do with their data, those sorts of things. So I think that input is really important. It's a really important stage not to miss. And I think you can take that input one step further as well and use it in the design of your questions as well. You know, so we call it pilot testing of questions. If you want to design a questionnaire, you come up with your questions. You might look other questions other people have asked in well-designed surveys before, but there might be things that you want to ask that no one's asked prior to this survey. So then, you might draft something, but I think it's always a really important step to say, okay, let's get some feedback on this. Do people understand this question? Does it resonate with them? Or do they really dislike it? Is there something about how I phrased this or the content of this which makes people unlikely to respond to it? Or even worse, are some groups of people less likely to respond to this than others? Because that's where you get into some issues. So I think for me, the take home is about really thinking through your design as far as possible. How can you include all the people that you need to, and getting their input on how it is that you're writing your survey and presenting your survey.
Well, thank you. That was a very useful recap. Can you give us a specific example, a study that you've conducted, and something that you could share with us, how you managed to overcome these issues?
So I guess I've got two really good surveys that would be good to talk about. One recent project, we looked at the impact of green and blue spaces on mental health and well-being, and that was in Wales. And this is an example of when it can be really useful to have survey data, because we were interested in both anxiety and depression and also well-being. We use data from general practices to look at mental health diagnoses and treatments, and that was from all practices across the country. So then you're less worried about not being able to capture certain groups, because for the most part, registration with the GP in Wales is very high, so most people are captured in that. But for well-being, and whether or not people have been to a green space, that's not the sort of thing that is held in those GP records, right? So then we were able to use survey data from what's called the National Survey for Wales, where they randomly select people from all across different parts of Wales, all different population groups, and survey them on whether they've actually been to their local green spaces, how's their mental well-being, how's their physical well-being. So I think that's quite a nice example of research that uses different types of data, and only by using both of them could you answer the questions. Another survey that I have worked closely with is the National Survey of Sexual Attitudes and Lifestyles. And that's a really good example of a survey that's put an awful lot of effort into making sure that its sample is really representative. So they're called NATSAL for short, National Survey of Sexual Attitudes and Lifestyles. And those surveys are designed to be nationally representative. They're important surveys. They only happen every 10 years. And they're kind of a barometer of the sexual health of the nation. Because it's a national survey, it's really important that they're capturing everybody. So they make efforts to target some groups who might be less likely to participate, or who might be in smaller numbers in the population, to make sure they get enough people from those groups to mean that they can actually do robust survey analyses of those data. One of the ways in which they do that is they might do what they call a boost sample. So they might invite more people in a key age group. So for the National for Sexual Attitudes and Lifestyles, they did a boost sample of young people, for example, to try and evaluate some public health interventions around like national chlamydia screening and that sort of thing. And they also did a boost sample to try and make sure they had enough people participating from different ethnic backgrounds, so that we could actually drill down a bit deeper into inequalities in sexual health and sexual behaviours and attitudes across different ethnic backgrounds. So that's one way of doing it.
So it sounds like it is possible. It might involve a bit of work, but it sounds like it's something that we definitely need to consider right from the beginning, and kind of build in and have that health equity hat on for the whole time. So what's your vision for the future when it comes to equitable data collection methods? What would you like to see?
Oh, good question. I think there are two things that I'd really like to see. And I think the first comes down to funding. I think funding that recognises the need for sort of high quality, these probability samples where we've got a representative group of people. Funding that doesn't assume all questions can be answered with an online survey that we just send out to a few emails or put on Facebook or something. The thing is, it's expensive to conduct those sorts of surveys. It takes a long time as well. If you think about the National Survey of Sexual Attitudes and Lifestyles, they're surveying, 15,000 people or so across the country. That data collection is going to take a long time. I think the last survey took 2 years to collect the data. So it's a big undertaking. but we really need them to ensure that our findings from survey research are representative of the population we're actually interested in, I guess. And I think the second thing that I would really love to see is a kind of mainstreaming of involving diverse groups of publics in the design of our surveys. So just to try and reduce the likelihood that some groups of people might be less likely to be invited or less likely to take part even if they get an invitation, or less likely to complete some key questions. So I think that for me would be really great. And that's something that we can all do even if we're doing smaller scale surveys. We can all kind of have those principles of co-creation and public involvement right in from the start.
Sounds great. I hope your wish will come true.
Well, it is nearly Christmas.
I know. Thank you so much for sharing your thoughts with us on this and your expertise.
Oh, no, thank you very much for having me.
As Rebecca said, surveys, as other methodologies, are not inherently inequitable, but conducting equity-sensitive surveys requires time, effort, and resources. The role of patient and public involvement and of funders seems to be a recurrent issue for our interviewees. Listen to our other episodes on that and follow #ImplementEquity for additional links and resources on the subject.